Hi guys, it's me Sky. I'm tuning in. Today's topic is a very important topic. I received a question from one of my subscribers, and the question was, when should one be prepared or aware that they have endometriosis? And I guess I can answer this question both personally and professionally. So, personally for myself, I started showing the symptoms at the age of 12. However, it was just brushed off, and I went to see a GP, and he said you could have irritable bowel syndrome or a urinary tract infection or something wrong with your kidneys, and decided to put me on the pill. Now, back then, being on the pill, I found it very uncomfortable to have it around so that my friends could see it, and I found it to be very embarrassing if people found out. At that age, I wasn't promiscuous or anything like that, so I struggled mentally with this diagnosis, so to speak, and the treatment. Now, I didn't get diagnosed, and I was being treated by several surgeons and doctors, and they all kind of went, yeah, it's probably just irritable bowel syndrome. And it wasn't until 17 years old where I had a massive cyst rupture, and the doctors thought it was my appendix rupturing. So it wasn't until then that they had to cut me open that they actually found the endometriosis there. So from that point there, I was placed on different hormone replacement therapies and things like that. Now, I want to raise awareness here that the technology and the evidence and the research today is so much more better than what was back for me when I was a child. However, the thing is that today the only way to still diagnose endometriosis is to go through a laparoscopic procedure. Now, most surgeons are very hesitant to cut open a child, definitely just for research issues, due to the fact that having surgery then creates its own problems afterwards. So you are prone to scar tissues and adhesions, and then with that, and you're battling the disease, if that's what you're diagnosed with, you've got these added issues that are causing you pain and things like that. So that's why doctors are very hesitant to cut open a child, and I certainly understand that. So they're trying to do preventative measures to try and not cut you open. So they will probably put you through an MRI or an ultrasound where they're hoping to find any endometrial sockets or any signs of cysts or anything like that. Now, I'm not dissing this treatment. However, in my 11 surgeries, and I've probably had God knows how many admissions, every ultrasound I've had has come back normal. And if you were to cut me open like my last procedure, I wasn't normal at all. It was a mess. And I've had 11 surgeries. So it shows you how quick that the endometriosis grows back. So for girls that are watching this or would like to know, I think you need to make yourself aware of what endometriosis is, and to make yourself aware of what the signs and symptoms are, because for yourself, if you're showing symptoms, I think it's very important that you speak up. And if you have a GP that you see, I think you need to go and see them and speak up to them, because you shouldn't be living with these symptoms. And the problem is a lot of girls or women are very hesitant to come forward as it's such a private issue. However, I'm here to kind of bust open that private door now and let you know that until you make yourself known with the doctors, that nothing is going to happen, and this is not right. So please get a journal or a diary, and I want you to document the days that you're having symptoms, because that's very important to take to a doctor or a surgeon and things like that, because it's evidence of what's actually happening to your body. And when you're actually being viewed by a doctor, you're not usually in the right headspace anyway, because they've given you medication. So that's why I feel it's very important to keep a journal. Now, just to touch on that on a professional note, there was a study conducted in Canberra. Now, the study was conducted by endometriosisaustralia.org.com. And so whoever's channeled through this study, they found that in Canberra, 1,000 schoolgirls got, between 16 and 18, got interviewed. And it found within that 1,000 girls, they found 93% had painful periods, 21% had severe period pain, and 26% missed school due to mixed symptoms and endometriosis-like symptoms. Now, given that was in 1,000 girls, to me, 93%, it doesn't sound normal at all. So I know with the research and study that's coming out, like, there is no cure. However, I feel it's important to be on top of when you start feeling systematic. Now, some women will have severe endometriosis and they won't even have a single symptom. And some women might have minor endometriosis and they could be having like 10 out of 10 pain. So it doesn't work traditionally, is probably the best way to put it. So since the studies are being done and it's so more and more girls are actually coming out and telling people that they've got these problems, that's how our research is going, and I think that's really important. I strongly recommend that if you've got daughters, tell them about endometriosis and ask them to be honest with you and not to be shy of what their symptoms and things are, because if you're noticing that something's not right, then there's a highly good chance that something isn't right. So I'm here to give you a voice, and I really want you all to have your voice ready to speak up and to put your health first. And that's the most important thing here. So I really want to thank the subscriber who sent the question through. I strongly recommend that please go see a doctor if you are having any symptoms. And I just want to ask, if you are viewing in through my Facebook channel, do you mind if you could please like it and share it? And if you're one of my subscribers on YouTube, can I ask that you please share the video? If you are going to subscribe to my site, just remember to hit subscribe and then like the page. So I really appreciate you all for your support, and I am very excited to announce that in a couple of weeks' time I'll be interviewing a surgeon. So stand by for that one. I'm very excited, and hopefully that we can get more and more information out to you as quick as possible. I hope you all are well, and I thank you again for so much for your support. Take care, guys. Mwah.